Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free training classes on clinical hypnosis with several free ebooks. How nicotine acts in the brain. Your brain is made up of billions of nerve cells. These communicate with each other by releasing chemical messengers called neurotransmitters. Each neurotransmitter is like a key that fits into a special lock called a receptor, activates the nerve cell that corresponds to that receptor. The nicotine molecule is in the form of a neurotransmitter called acetylcholine. Acetylcholine and its receptors are involved in many functions, including muscle movement, breathing, heart rate, learning, and memory. They can also cause the release of other neurotransmitters and hormones that affect your mood, appetite, memory, and more. When nicotine enters the brain, it attaches to acetylcholine receptors and mimics their actions. Nicotine also activates areas of the brain involved in producing feelings of pleasure and gratification. Scientists recently discovered that nicotine raises levels of a neurotransmitter called dopamine in the parts of the brain that produce these feelings of pleasure and gratification. Dopamine, sometimes known as the pleasure molecule, is the same neurotransmitter involved in nicotine. It's the same neurotransmitter involved in addiction to other drugs such as cocaine and heroin. Researchers now believe that this change in dopamine plays a key role in all addictions. This will explain why it is so difficult to quit smoking. Easy to start and hard to quit. Did you know that nicotine is as addictive as cocaine or heroin? When nicotine is used repeatedly, either by smoking, chewing, or snorting tobacco, the body develops a tolerance to it. When you build up a tolerance, you need more of the drug to get the same effects. Eventually, you become addicted, and once addicted, it is very difficult to kick the habit. There are no physical reasons to start smoking. Your body doesn't need tobacco the way it needs food, water, sleep, exercise. In fact, many of the chemicals in cigarettes, such as nicotine, etc., are actually poisons that can even kill you in high enough doses. Your body is intelligent and defends itself when it is being poisoned. Or don't you remember the first time you tried a cigarette? The pain you feel in your chest, the burning in your throat, chest and stomach. You might even feel dizzy and nauseous. Remember that you were born without smoking, without tobacco, so you can live perfectly well without the need to smoke. Tobacco is dangerous in all its forms, smoked, chewed, and sniffed. It does no good to replace regular cigarettes with products that seem better for your health, such as filter cigarettes or low nicotine cigarettes. The truth is that there is still a lot that scientists do not know about the effects of nicotine on the brain. Much remains to be discovered, the brain's best defense against nicotine is not to use it. Before you light up a cigarette, think about it. Fagerstrom test. There are certain types of questionnaires specifically designed to assess an individual smoker's physical dependence on nicotine. Several models have been used, the most widely used being the Fagerstrom test, designed by this Swedish researcher and which has proved very useful in clinical practice. Scores in this test of 4 or less indicate mild dependence. Values of 5 or 6 imply moderate dependence. If the score is 7 or more, dependence is high. Results: mild dependence 4 or less, moderate dependence 5 or 6, high dependence 7 or more, maximum score 11. Nicotine is a drug found naturally in tobacco. Tobacco, it is as highly addictive as heroin or cocaine. Over time, the body becomes physically and psychologically dependent on nicotine, and some studies have shown that smokers have to overcome both dependencies to quit for good and stay smoke-free. When smoke is inhaled, nicotine penetrates deep into the lungs, causing the body to become physically and psychologically dependent on nicotine into the lungs, from where it quickly passes into the bloodstream and is transported throughout the body. Nicotine affects many parts of the body, including the heart and blood vessels, the hormonal system, the body's metabolism, and the brain. Nicotine can be detected in breast milk and in the mucous secretions of the cervix of smokers. During pregnancy, nicotine crosses the placenta freely and has been detected in the amniotic fluids and umbilical cord blood of newborns. Several different factors can influence the rate of nicotine metabolism and excretion. In general, nicotine or its derivatives are present in the body of a regular smoker for 3 or 4 days after quitting smoking. Nicotine produces a feeling of pleasure that makes the person want to smoke more. It also produces a depressant effect by interfering with the flow of information between nerve cells. As the nervous system adapts to nicotine, smokers tend to increase the number of cigarettes they smoke and thus increase the amount of nicotine in the blood. After a while, the smoker develops a tolerance to the drug, which leads to an increase in cigarette consumption. Eventually, the smoker reaches a certain nicotine level and then smokes to maintain that level. Nicotine withdrawal. When smokers try to cut down on cigarettes or quit the absence of nicotine or quit smoking, the absence of nicotine causes withdrawal symptoms, both physical and psychological. Physically, the body reacts to the absence of nicotine. Psychologically, the smoker is faced with having to quit, which is a major change in behavior. The smoker has to deal with both factors to be successful in quitting. Most withdrawal symptoms start between 2 and 12 hours after the last cigarette, peak between 36 and 72 hours later, and gradually decrease. Nicotine activates a region of the brain known as the mesolimbic dopaminergic system, stimulating the production of dopamine, which has been typified as a biochemical reward system and therefore plays an important role in the need for nicotine and the establishment of dependence. Withdrawal symptoms. Dizziness may initially last 1 to 2 days, urge and craving to smoke, depression, difficulty concentrating, drowsiness and trouble sleeping, feelings of frustration and anger, irritability, sleeping problems, difficulty concentrating, restlessness. These symptoms cause the person to start smoking enough cigarettes again to raise the nicotine levels in the blood to the level they were at before, when they did not yet have the symptoms. But these symptoms should never be an excuse to start smoking again. When nicotine is inhaled, smoked, it is basically absorbed through the lungs, within seconds reaching receptors in the nervous system. Over time, these neuroreceptors adapt to the nicotine, while the amount inhaled increases. Remember that the first cigarettes were not even pleasant for you. On the other hand, as an addictive drug, nicotine leads to tolerance. Nicotine addiction makes us dependent on tobacco. Nicotine causes physical dependence and makes the smoker smoke in a way that absorbs as much nicotine as the body needs. If the person has smoked regularly for a few weeks or more and suddenly stops using tobacco or significantly reduces the number of cigarettes, withdrawal symptoms will occur, usually within a few hours of the last cigarette smoked. These symptoms reach their peak approximately 2 to 3 days later and can last from a few hours to a few days. If you're interested in learning more about clinical hypnosis, watch our next video, Preparing the Action Plan. Remember to study the description of this video, where you can find a link to free training classes on clinical hypnosis, with several free ebooks as well. If you have questions, ask them in the comments area about this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.